Hello, I'm Dr. Kris Scholl from Bucks County Smiles. Today I'm going to be reviewing with you some remedies for common dental problems experienced at home, particularly when you can't visit your dentist for one reason or another. Currently, right now, it may be because we are closed due to the COVID pandemic and only able to see absolute dental emergencies. You may be thinking, well, I have a dental emergency, my tooth's broken, it's really bothering me, it's annoying, and I don't know what's gonna happen. So you're right, this is a common problem, and it is a problem that should be addressed by a dentist as soon as possible. So what do you do in the meantime when you can't come in and see us right away? What I decided to do was take a walk down to my CVS. I actually am really lucky. I have one right at the end of my block here. And I chose some dental products that are available and I believe should be available for most of you in your pharmacy, whatever's closest nearby to your home. So there's one product here that I want to show you called Dentemp. So there are other products very similar to this. This is the one, sort of the name brand. I don't have any affiliation with this product. I just chose it because I'm familiar with it. So this says Dentemp, loose cap and lost filling repair. So I'm opening Dentemp now, and it comes with a tiny little jar of a paste-like product. And it also comes with this little applicator. You can see here. It has a sort of rounded end to it and a curved handle. And this is the tiny little jar of Dentemp. So when you look inside, you'll see this white paste. And it will have a slight smell like cloves, if you're familiar with the smell of cloves from cooking and baking. And that's because this is made from a product called eugenol. Eugenol is made from cloves, and it's been used for hundreds of years actually in dental remedies, because eugenol is very soothing to the pulp or to the nerve inside the tooth. So I've removed some of the product here. Now, often you'll have a hole in the middle of the tooth, or perhaps a corner of it has chipped off. And so my hope is that you're dealing with a tooth that you can easily see in the mirror, or have someone help you, maybe hold a flashlight so that you can see further back in your mouth where it is dark. Try to have some good lighting like I have in my bathroom here. So here's the material. And I'm just gonna demonstrate. I actually have a missing filling here. And I am going to apply the product. Now, I should say, prior to making this video, I did wash my hands very thoroughly. That's very important. To make sure that your hands are clean, free of germs. You don't want to introduce anything into your mouth that doesn't belong there. So just wanted to say that. You may find that if you take too much of this material at one time, that it's going to be difficult to place, especially if it's a small hole. And now, you may need to use your other finger to place it in the area of the lost filling or tooth. And then you're gonna just mold it. I'm gonna get rid of the excess here off of my instrument. And then you can use the end of it to mold it in place. Now you'll find that this has sort of a putty consistency when you first put it in there. It will set over time and become more firm. depending on the location that you're placing it will determine how well it stays in place and whether it washes out. What I want you to be careful of is if you're packing this sort of in between two teeth or along the gum line, I want you to try to make sure that there's not a lot of excess overhanging on the gum tissue, because over time that can become irritating to the gum tissue itself. So we just want to try not, just to use the minimal amount of product necessary to close the gap. One other product that I found when I went to CVS is something that I actually wasn't familiar with. It's called Ortho Dots. Just hold this up so you can see it. And these are actually small square silicone pieces that were created or intended for patients who have brackets. They're undergoing orthodontic therapy and they have braces on their teeth. And sometimes those braces are, they have a wire sticking out of them, or they have a sharp edge, and that can be very irritating to the cheek or lip tissue that's rubbing against it. So that's what these are primarily for, but I did also try one of them out to see if it would work in one of the cases that we were just discussing, where your tooth has chipped and is rough on the edge or missing a filling. And I found that actually it could be a decent alternative to this other material. So I'm going to unwrap these Ortho Dots. And they come in a packet of 4. You can see I've removed one here already. They're pretty tiny. So just a little bit larger than the size of a braces bracket. You have to unpeel or peel off this plastic. So this is what it looks like when you unwrap it. So this is made of silicone. It's medical grade silicone, so even if you swallow it, you don't have to worry. It's not very likely to cause allergic reactions, although there is a message on the package saying if you experience an allergic reaction, and that would probably be, an itchiness in the gum or a burning sensation. Again, pretty unlikely, but if you do experience that, to discontinue using it. So when you take these little squares out, you'll see one side has, it's a little hard to see, but one side has some lines on it, and that's the side that goes against the tooth. So you just take the tooth, and you're gonna press it, and it actually molds really nicely to the tooth. You can see here, and you can kind of press it. You can use the little indentations between the teeth to sort of help lock it in place there. Now this is not going to stay in place as long as the Dentemp might. You might have better success with one over the other depending on the location where you're trying to place it. But I like this material because it's insulating. So particularly if you have an issue on the outside of the tooth, nearby your cheek, it feels soothing. It feels like there's an insulation there that hot or cold temperature is going to be less likely to irritate the tooth there. I did eat my lunch with one of these in place, and as soon as I stopped chewing carefully and sort of watching how I move my teeth and my tongue and cheeks, once I let my guard down, it did become dislodged. However, I think if you're careful and you're eating soft foods and you have one of these in place, you may be able to have it stay in place throughout the duration of a meal. And you can always replace them as necessary. These are 2 products that are different in terms of their texture and how they work, and both of them are decent alternatives that when you can't come in to see us and you need something to hold you over. So I welcome any questions, comments that you have, even suggestions of videos that you'd like to see. Please send them my way, either comment below or send us a text or an email. We're standing by to get your messages. Now that our office is closed, we are still here for you. So please reach out to Bucks County Smiles whenever you need something. Hope you have a great day. Stay healthy.